science.
The dream of electrically bypassing spinal cord injuries to restore movement to paralysed limbs is becoming a reality. Thanks to technology developed by researchers at Ohio State University in Columbus, a quadriplegic man has been able to use his own thoughts to move his paralysed arm. 23-year-old Ian Burkhart, who's paralysed from the neck down, is the first patient ever to use Neurobridge. It's an electronic neural bypass system that reconnects the brain directly to the muscles and enables the patient to voluntarily control a paralysed limb by sending signals. Neurobridge technology involves implanting a chip smaller than a pea into the patient's brain to read electrical activity in the area responsible for hand motion.
It's much like a heart bypass, but instead of bypassing blood, we're actually bypassing electrical signals. We're taking those signals from the brain, going around the injury, and actually going directly to the muscles.
Signals are continuously gathered and decoded using special software that figures out which muscles are being told to contract. This is then passed on to an electric stimulator that activates those muscles. It all happens within 1/10 of a second, providing almost instantaneous control. For Burkhart, the prospect of moving his limbs again is exciting and potentially life-changing.
Picking up a cup of water and drinking it, or brushing your teeth, or feeding yourself, you know, those things, if you can do those on your own, makes a big difference in your life.
The team plans to test Neurobridge on 4 other patients as part of the ongoing clinical trial. Staying in the medical field, scientists in Finland have developed a lightweight, handheld, hyperspectral imaging camera. They say it can detect the early stages of skin cancer, which are invisible to the naked eye. The camera can take enlarged spectral images of the tested areas in seconds. It highlights differences between healthy and potentially cancerous skin, so that early signs of skin damage leading to cancer can be diagnosed. The hyperspectral camera is quite similar to a regular digital camera. Except when a normal digital camera takes 3 large wavelengths in one shot, known as R, G and B, or red, green and blue, this one takes narrower wavelengths from 500 millimeters to 850 nanometers. The hyperspectral camera has also been used to detect the borders of poorly delineated skin tumours. Lentigo malignas, for example, are difficult to detect with the naked eye and can redevelop if not eliminated entirely during surgery. Precancerous skin conditions such as sunspots can also be detected.
Surrounding this lesion there can be more lesions, like subclinical lesions, and that's what we want to do with hyperspectral imaging. We want to see all the subclinical lesions, so we can now see them before the treatment, and then after the treatment we image the whole area again to see if there's some lesions left.
Clinical trials are being conducted at hospitals throughout Finland. Researchers say the initial results look promising.